Hey guys, here for a really quick 26-week update. Today I'm 26 weeks and 2 days, and to sum up how I've been feeling since my last video posted, I've been feeling frustrated, anxious, and emotional, and I'll explain real quick why. So since the last video, I was supposed to see the DO for hip pain, pelvic pain, pubic pain, pressure, all that good stuff, and a really long story short, my primary care doctor won't authorize a referral because apparently it's been too long since I've seen her, which in a normal world, if I hadn't seen her in a year, I'd completely understand, no problem. But I actually saw her, I think it was the first week of May when I posted my video that I was spotting severely and I thought I was miscarrying. So that was May, 4 months ago. I had a full physical, a PAP, you name it, blood work, ultrasound. And for the last 7 days, I've been trying to get a hold of her physician assistant. I've left 3 voice messages, and I haven't got a call back. So maybe some of you watching this video work in a doctor's office in a kind of medical setting. Please let me know if that's standard. I personally have worked for an optometrist for 3 years, and I was the one that would call all the patients back for her. And I know that I did it on my lunch break, and at the end of the day, to the best of my ability. I couldn't imagine making one of the patients wait 7 days for just a phone call back. Just a 10-minute phone call, So please let me know if that is pretty standard nowadays, or if that's, if I am justified with my aggravation. I have been very emotional because my oldest started kindergarten, as I mentioned, and he's been having a really hard time. He's like the sweetest little boy you'll ever meet. His little high-pitched voice and wears glasses. If you watch my video called telling our oldest we're expecting, that's my oldest, obviously. And he's just a sweetheart. He's just not like a mean boy. He's like very sensitive, and anyway, he's been having a really hard time, coming home with bad notes every day saying he's doing these things I can't even imagine him doing. I've just been like emotional wreck, like crying pretty often. And today he actually got a new kindergarten teacher, and I met her and feel so much better, so I'm hoping that that will clear up. And since the last video, I started wearing my maternity support belt, and that seems to help when I'm around the house with like the hip pain and just kind of feeling like loose. I don't know, I feel like my bones and my hips and everything's just kind of wobbling around, so when I put that on nice and tight, I feel secure and I like it. Someone mentioned to me that they think I might have, I think it's symphysis pubic dysfunction, SPD. And I've read a lot about it, and it does sound like I might have that. Maybe not severe or severe yet, but it's something I would like to mention to the doctor that I've been waiting to see, the DO. Again, if anyone watching this has had that, you can let me know. Particularly, the reasons why I think I have it is when I'm laying in bed at night and I go to flip over. It's just a very unusual, well, first of all, it always feels like I got punched or kicked in my crotch. Like it feels like I have a bruised pubic bone all the time. It's very tender to push on it. And in fact, my last midwife appointment was 2 weeks ago when she went to measure my fundus, my uterus. When she pushed down below, I jumped. It hurt. And that was actually an example they used in some of the things I read about SPD. But yeah, other than that, like rolling over in bed in the middle of the night, it feels very weird if I can't, get both my legs at the same time. Standing on one leg to get my foot in an article of clothing, it's very painful, and it doesn't feel right. And I find myself, without even consciously knowing, really, like I take my hand and I push on my pubic bone when I'm just standing like in the kitchen because it seems to bring some kind of relief. So I think that's about it for week 26. I don't know if you've seen this yet. I think it's drying, but I promise I'm not lactating on my shirt. My little man was laying on me and he fell asleep, and that's so sweet. So I'll go ahead and do a belly shot for week 26. There's that. I don't know if you can see, but my belly button's like full force, buddy. Even when I have shorts on with the tall band, like you can still very much see my belly button. So I don't know if I'm carrying high or low. I seem to get a lot of people think I'm carrying high, and I think I'm carrying higher than I did with my boys, but I'm not really sure. I always feel like I naturally carry low, but I'm not really sure. So there's that. All right, until next time, bye.